Hello, nurses all over the world. My name is Nurse Felicia. I want to officially welcome you to my YouTube channel. If you are just watching this video for the first time or you're just hearing about my name, and if you are a returning subscriber, I want to appreciate you for coming back to my YouTube channel. I want to really appreciate you. And if you are following this video, you're just watching this video, you have not subscribed, then I want to ask you why I want you to subscribe to my channel. I mean you, I'm talking to you. Please subscribe to my channel so that you get to see my video as soon as possible, as soon as it is released. All right, so without wasting much of our time, we'll be talking about understanding the connection between communication and patient safety. So that's our topic for today. And I want you to sit back and relax and let's enjoy this together. Because, I'm also a nurse. I'm still practicing as a nurse. And as passionate as I am as a nurse educator, I also love learning. I love reading. After this video, if you have your comment, you have a suggestion of topics you want me to take that you don't understand, you want us to learn together, why not? Feel free to put it in the comment section and I will be more than happy to trade the topic. Thank you. So let's get to the topic of today. I just want you to understand the connection between communication and patient safety. So permit me to use my device today, and we're talking about some key words today. We'll be talking about communication, we're talking about patient safety, and we are going to just oppose the two together and we know the connection between them. So anytime you want to talk about communication or patient safety, then you know that is one of the key roles is either you are a nursing student or you are a practicing nurse. You know that in ensuring a patient safety, communication plays a vital role. When I was reading and making my research about this particular topic, I realized that a particular research was carried out in the US, and they realized that about 48 to 92,000 of patients die annually in the United States because of lack of communication. 70% of the death rate was recorded because of lack of communication. So this particular topic is a very vital topic that I don't want you to trivialize. I don't want you to just take with levity. I want you to really learn from this topic. Patient safety always comes first. Whenever any healthcare is provided, then you think of patient safety. Even if you want to, no matter what you want to do as a nurse, your patient comes first. I want you to hold that, and I want you to take note of that. I just want you to know that patient-safe communication in nursing is a goal-oriented activity that is focused on helping patients attain their optimal health outcomes. And it is a means by which nurses gather and share information. You clarify, you verify accurate interpretation of information, and establish a process of working collaboratively with patients, their family, and other healthcare providers. What's the outcome? What are we trying to achieve with this? Is just to achieve the common goal of safe, high quality patient care. So there are 6 primary areas of role responsibility of nurses that I've itemized here, where communication may break down. So I have itemized the 6 primary roles that nurses should take notes when it comes to patient-safe communication. Number 1 is establish the nurse-patient relationship. So many nurses, they want to treat the cause and want to ignore the bearer of the cause. How do I mean? When a patient, you're just trying to say, okay, Mrs. Jones, how are you today? what happened? And oh, I am having headache, and oh, is that all? And you go back to the nurse station, you want to go and document, but it goes beyond that. You have to establish a patient nurse relationship with the patient. And oftentimes you agree with me that while you were conversing with the patient, you try to make your nursing diagnosis. Like you pick a lot of things from their conversation. For example, a patient comes in with back pain, a sudden onset of back pain, and you're wondering what happened, and the patient will say, oh, yesterday I don't know what happened. I just discovered that I was having back pain. And if I were you, the next thing I would ask is, if you don't mind, what sort of job do you do? It's not you prognosing, you don't have to ask the story of their life. But when it comes to meeting a patient, and there's a general saying that first impression lasts longer. We can't overemphasize the area of this nurse-patient relationship. It's something that has to be built. And if you can't build the trust, you meeting your patient for the first time, then when do you want to build the trust? If you can't build the trust and your rapport, you just want to, obviously, you're going to contribute to the care of the patient, but to some extent, some patients just want to be heard. They just want you to listen. You know, and this part of the world that I am practicing, like sometimes patients will want to just relate with you, they want to talk to you, and they're saying, oh, Felicia, sometimes they start from a week or a month. The patient want to ventilate a lot of things to you. Why not just listen? I know you might be busy, you'll have a lot of patients to attend to. And that is why I'm going to remind you that there's individuality in care. You can't, because the patient is just straight to the point, just like the regular thing that we do. We have different type of personality, and we have people. Some people are just straight to the point, and some people, they want to tell you story. So build that patient nurse relationship. It will help you. It will help your communication skill, and it will ensure patient safety, like the way I would just like to put it. So how do you establish this? You build trust and rapport with the patient. Through the trust and rapport, patients are more open to sharing personal health information. Yeah, for example, you come to me and say, oh, Felicia, you are here, you are in the clinic. How are you? I'm good. And the next thing you're saying, what brought you in today? I told you I have headache. And the next you say, oh, you can wait for the doctor. The doctor is going to be with you. And I'm like, what's going on here? You know, but there's still, peradventure the patient even came in with their children or their spouse. You can just ask, oh, what's your name? Oh, you have lovely children. You just build rapport. It's so essential, I must say. So the next thing is, when you do that, it helps them to describe how they feel to you. And you are able to infer, like you make your inference about their coping skill. The doctor is still going to come, the pharmacy will make their recommendation, the pharmacist, I mean, but you as a nurse, you are just like the baseline encounter, like the patient is going to encounter you first. And whatever you do to the patient goes a long way when it comes to building rapport and establishing the trust with the patient. Number two is you exchange necessary information with the patient. You exchange necessary information with the patient. And how do you do this? You keep the patient and their family informed. You have to keep them informed. You don't do things without explaining to the patient. You don't say, okay, take this drug. You said you have a headache, so take this drug. It might not work for me because you have not said anything. You can just keep them informed, even if the patient is unconscious. There are family members there. You can just tell them, oh, this is paracetamol that I'm giving to Mrs. Jones. This is going to help with is a form of analgesia. And though it's not a stronger one, we're just going to help the patient to at least get rid of the pain. And, obviously a patient that is telling you that is having headache is not unconscious. So you can just explain to them. You explain the possible side effects to them. You tell them so many things. Oh, for example, imagine that you have given me a drug for headache. Do not tell me the side effect. Do not tell me anything. Just tell me, oh, this will work for your headache. And at the end of the day, it worsens it. So tell me, how do you want to explain to me that, oh, sorry, sometimes the side effects, well, you don't even ask any question. You don't even know if I'm allergic to this drug, to this medication. So going back to number one, you have to build that rapport and trust. If you have explained everything to the patient that, oh, you taking this paracetamol, these are the possible side effects you might likely see, and the patient is now experiencing it, then it gives that patient a sense of, oh, the nurse told me before she administered this medication to me. So I want you to take note of that point. Then number three, you ensure accuracy in delivering the correct treatment regimen to the correct patients. When it comes to building communication, like ensuring patient safety, you have to ensure accuracy in delivering the correct treatment regimen to the correct patient. This is so important. You don't want to make this mistake. You don't even want to jump into any patient without asking them of their name. Here where I practice, you have to do a 3-point identity check. You have to ask them of their name, you have to ask them of their date of birth, and you have to ask them of their address. I can't, because my colleague admitted a patient and I'm going to the room of that patient, I'm not asking anything. No, it won't work because I am liable. Everybody have their license to defend. It won't be too much. Sometimes patients will say, oh, I just told the doctor, I just told your colleague. And I'm like, I'm very sorry. That's the normal thing that we have to do here. Before I do anything for you, I have to ask you of your name, your date of birth, and your address. So that gives me, because sometimes we might have 3 Mrs. Jones in my ward, and I've just come to you and say, oh, what's your name? And you said, Miss Jones, no date of birth, because I know there's no how a patient, like 3 patients in the ward, will be having the same name, the same date of birth, and the same address. Is not possible. So we just want to be careful of that. So before you discharge that, you administer that medication, before you discharge that duty, you want to verify. You want to make sure it is accurate. You are doing it to the right patients. So I want you to take note of that. And think about it, that you entered my room and say, oh, what's your name? My name is Felicia. And you say, you want to administer a medication. I brought, and what I presented with was headache, and you want to give me an anti-hypertensive drug, and you did not ask, because probably there are 2 Felicia in your ward. Let's think about it, that the nurse did not even tell me the drug that he or she wants to give me. And I'm like, oh, what's the name of the medication? And you're like, oh, this is losartan, this is nifedipine, and I'm just going, and you're like, oh, what does that do? And you say, oh, it's an antihypertensive drug. The doctor has just ordered it that I should give it to you. I'm like, the last time I checked, I did not have hypertension. How will you feel as a nurse? What do you want me to think about you as a nurse? You don't want to look incompetent to your patients. The next time you want to bring paracetamol for me, I will ask you a lot of questions before I take it from you. Or I just take it and not use it, or I decline that, no, don't worry, I don't have a headache, I'll just go and manage it at home. And you're like, no, Felicia, you have to take this. I'm not like, no, I don't want, because I have the right to refuse medication. What's going on in my mind is, I don't even know if it is diabetic medication that you are bringing this time. You will get what I mean. So it ensures communication and it also ensures patient safety. So number 4 is you exchange essential patient information with other healthcare provider. You have to also manage the multidisciplinary parts when in caring for your patients. You can't treat your patient in isolation. There are a lot of providers that also be involved in your patient care. So you want to also exchange essential information about your patients with other healthcare provider. And this will also help to receive information from and to provide information to members of the healthcare team to plan care, to work. It will help to plan their care. It will help to work collaboratively to deliver integrated interdisciplinary care services. We have interdisciplinary care services. Everybody is coming in, the pharmacist, the doctor, the physiotherapist. A lot of people are coming in. Then you as a nurse, you must be able to tell them essential information about your patient. And I also want to put it to you that to some extent, whatever you document also goes a long way. You don't want to say, oh, the doctor is still going to clerk the patient. So a lot of things are connected to your documentation. So I want to tell you that you should take note of that. And number 5 is that you should transfer responsibility of care of the patient and essential patient information to another. You must be able to, there's continuity of care when it comes to patient care. So you don't want to do something that is not transferable, that another person will find it difficult to continue from where you stopped. Then communication is impeded in that setting. Communication will be broken. That channel of communication is not going to be smooth. So you have to be very careful in ensuring that your patient care can be continued. You can continue that patient care, and it's not difficult for you to hand over your patient. You don't want to be the type of nurse that your colleague are coming to work and they are saying, oh, she's the one doing the night duty, I'm doing the day. I don't know. She's not going to hand over very well, and I'm going to find it difficult to continue with the care of the patient. Then the patient safety is at stake. So you have to be very careful of that. Make sure that you hand off your care and you transfer your responsibility to another nurse, another professional colleague of yours, so that while leaving your own shift, they can continue the care. And the last one is you ensure accuracy in interpreting information. To ensure information exchange between nurse and patient and other members of healthcare team is interpreted as intended. Whatever you don't understand, nobody is going to crucify you for this. Please ask questions. Are you a practicing nurse or a student nurse? I want to advise you today, please always ask questions. And if you were like me, when I started working here, like practicing as an Irish trained nurse, the accent is just so different, if you get what I mean. And when the patients are talking, they've talked and they are done. And I have not been able to pick so much. It's not a matter of, I did my IELTS and I passed my listening skill. But I'm telling you, when you get to the field, you will understand what I mean. There are some vital things or some short words you can still pick. But when they start their story, and I went to my manager and I said, oh, I can't hear what this patient is saying. I can't really hear what they are saying. And she said, Felicia, don't be scared to ask them to repeat themselves. The best thing you can do for yourself is to ask questions. And the worst thing that can happen to you is to stand in the law court for what the patient didn't say that you have written. And I'm like, oh, that was actually an eye-opener to me. Now, okay. So Anytime I am unable to hear anything, I will say, oh, say that again, say that again. And they're happy to do that because it's so easy for you to write. But the question is, have you documented the right thing? Our doctors are blessed with a good handwriting, and you can't see what they have done. Like they did their clerking and you cannot see it. It's so it's so fair enough. Like you can just call on the doctor and say, oh, sorry, you said some things about the patient I don't understand. Or you go and verify from the patient yourself. Just to be on the safe side. Just go and verify from the patient, because by the time things go wrong, you're going to answer for yourself. Any doctor that is involved is going to answer for him or herself. So in ensuring this a smooth communication and patient safety, you have to make sure that there's accuracy in your documentation. There's accuracy in your documentation. So the consequences of all this communication breakdown during performance of this role responsibility jeopardizes patient safety. So if there's a communication breakdown, I've said it, but if the 6 roles that I've said is done the other way around, then it will jeopardize the patient safety. So now I'll quickly talk about the connection between this patient safety and communication. Though I've said it before. So the critical connection between communication and patient safety is that all nurses and other healthcare providers, they make clinical decisions. They plan treatments and they perform intervention on patients based on available information that is communicated between healthcare team members and the patient. I want to come again. The critical connection between this communication and patient safety that we are talking about is that nurses and other healthcare providers, they should make clinical decisions, plan treatments, and perform intervention on patients based on available information that is communicated between healthcare team and the patient. There's nothing you can do aside the patient. Whatever the patient calls it, that's what it is. If a patient is saying, oh, you are saying, oh, what is your pain scale? Like you want to rate your pain on a scale of 0 to 10, what will you call it? And the patient is saying 8, and the patient is still smiling and saying, oh, 8. And you can't make your judgment and say, oh, no, when you have 8, you should be screaming and you are crying. No. Whatever the patient calls it, that's what it is. Exception to that is in mental illness. I don't just want to go there. You want to quickly think about pain threshold. You have patients that have high pain threshold and low pain threshold. So people that have high pain threshold can have pain of 10 out of 10, pain scale of 10 out of 10, and they are still communicating with you. And you have another patient that has 2 over 10, and they're already squeezing their face. You want to be very careful when it comes to communication and patient safety. You cannot separate them, because in ensuring patient safety, you have to communicate. And that still boils down to you as a nurse. Make sure that you have a good communication skill. Have a good communication skill. Build trust and rapport with your patient. Don't forget, I mentioned earlier that first impression lasts longer. Make sure that you build your trust with your patient. Wear a good smile. Like, I'm not saying you should laugh when it's not funny. Like a patient is crying and you are laughing. That's not what I'm saying. But there should be an aura that comes with you whenever you meet a patient. And that's why I'm still going to put it to you that if you are not feeling fine, you want to care for someone, and you are not feeling well, it's better for you to just take sick leave, stay at home, or you are not psychologically you are not okay, instead of transferring your aggression to your patient, don't forget that might be the first and the last time you're going to be seeing the patient. So you can't come tomorrow and come and explain to me as a patient that, oh, sorry, I was not feeling great yesterday, I was sick. Then whenever I see you, whatever you have done for me in the first time, that's what I carry about. So your communication skill is very important. And I want to tell you today, as a nurse or a practicing nurse, that your communication has a lot to do in ensuring your patient safety, wherever you are practicing or you are doing your clinicals, you're doing your internship. Your communication will ensure your patient safety. Okay, so we have come to the end of this topic for today. I want to hear from you as well. Comment, share your experience with me, and don't forget, suggest that topic that you're finding out that you want me to treat. So until then, I remain Nurse Felicia, and bye bye.